Hi everyone, a very good evening and a warm welcome to Dr. Nilanjana, AML Rank 11 scorer. She's already into Tata and have started her course there as well and still wanting to clear INI and has scored a very good rank. Hi Nilanjana.
Hello, sir. Hello, sir.
So how are you and how is it feeling now that you have two options of both Tata and Central Institute? What is your choice and why so?
Sir, I am feeling really happy. INA was never a plan for me, sir. I had always thought about taking up Tata as big. It was my distant dream to be in that institute, like when I was started my preparation for oncology. But then I thought that since the pattern, like for NEET SS changed, I wanted to give one more try for I had just sir started my preparation in February after my tenure had ended in 2025 only, sir. So, the February 2025. After that, I started my preparation. So I thought that in March I had appeared for NEET, and so I thought that I should try 2 months. When I got 2 months for preparing for INI, so I thought of giving it a try, sir.
So, tell me something about your background, your MBBS, MD. Where are you from?
So basically, I'm from Assam. I have done my MBBS from Assam Medical College, Dibrugarh, and I passed out in the year 2019. After that, I pursued MD medicine from AIIMS Rishikesh, and I my tenure had ended in February 2025, sir.
And why oncology? From medicine, what was the driving force towards oncology?
So there were a few reasons. One of which is very personal. Like my mother, she had succumbed to gastric cancer in the year 2020, and she was diagnosed at a very terminal state, sir. And the oncologist who was treating her, I'd like to take his name, Dr. Umesh Das. He actually did not just actually post diagnosis. She had lived for 14 months, sir, with terminal stage gastric cancer, and the her oncologist, he did not just prolong her survival, but also gave her a very good quality of life, sir. At that time only I had a little inclination towards medical oncology, but obviously at that time DM was not in the picture. I was just preparing for my PG at that time. So after that, in the third year of my residency, we used to see a lot of cases, CKD, CLD, heart failure. All those cases, sir, we used to admit and give the initial management. But whenever we used to see a cancer patient, we used to just straight away, especially the solid malignancies, we used to straight away refer them to the Department of Medical Oncology. So at that time only, I felt very fascinated. Like I thought there is so much to learn about it that we are not, and also I did not have any exposure during my residency. And when I finally started, sir, and also one more thing which I noticed was that, sir, whenever we used to get a terminal stage cancer patient, we used to think that there is nothing much to do, so better to send them home or for hospice, sir. But then I realized that the oncologists, they do not think it like that. Like there is so much more to do with such patients, and I think oncology is a branch which which is a blend of both medical knowledge as well as empathy, sir. So that is something which drove me more towards this branch, sir. And finally, when I started studying for oncology, I saw that it is so evolving. Like every day, there are some new developments coming up, and also there is so much scope for research, sir. And that is why I thought that it would be the best for me, sir.
Two good things you have brought. One is empathy and the evolve branch of its oncology.
Yes,
So,
sir.
being a doctor is important to diagnose and to treat in the right way is important. As important is to be empathetic, more
Yes,
so
sir.
when you are an oncologist. That
Yes, sir.
gives a huge effect, be it a placebo effect or whatever it is. It
Yes, sir.
actually adds
Definitely.
to the quality of life. If you actually do a trial, then it adds to the quantity of life as well. And the
Yes.
second thing, as you told, one of the unique branches where every day you tend to see with something new, and what you saw yesterday might actually have been surpassed by something new, be it a drug, be it a diagnostic method. Everything is evolving. what we saw as a lung cancer equal to death a decade ago is now we are seeing trials with the something which is trying to put it into a chronic disease kind of a picture. So that
Yes,
is how this field is evolving, and that is really fascinating enough for you to get this as a branch and pursue this in your life.
yes, sir.
So
Yes,
how
sir,
did Dr.
definitely.
Tales come into this picture?
Yes, sir. So when I started my started preparing for oncology, sir, in the year in January, I like downloaded the PDF of Devita, and I just read a few things, and I went totally clueless, sir. So that is when I decided I subscribed to DocTutorials. I had watched the videos initially, and then I made my own notes, sir, and I revised those notes, sir, multiple times, and then I did the Devita-based MCQs, and also gave GTs, sir. Like prior to 1 month prior to INISS, I was giving GTs every 3 days, sir. Every 3 to 4 days, I was appearing for the GTs, sir. And especially, I could see that the MCQs, they were very much like Devita, the references were all from Devita only, sir. Especially the tables also, they were from Devita. So even if you're not studying studying Devita, if you're solving the MCQs, I think that is enough for at least the entrance exam part, sir. So that is how it was, and then finally the GTs were also very exam oriented, sir. Especially there were a lot of practical questions also. Like if you're, I was not exposed to oncology, I was not like working in the ward or something, but there are a lot of things which I got from the GT, a lot of knowledge which I got from the GTs, sir, practical knowledge. So that is how it really helped my during my preparation, sir.
Another a few more important things she has brought out is do see all the videos, but making notes and a continuous revision of your notes actually adds on to the strength of your preparation. That is more important. Just a view overview of video or and passing on to the next chapter will be of useful, but more and more important is to take your own notes and keep revising it multiple times. Two big take home points from our achiever that these are actually going to help you in kind of facing your exam without a fear, if I'm right.
Yes, yes, sir. Yes, sir. Definitely.
So you were able to see videos, see solve the MCQs, and how did you kind of come to, get to in touch up with your updates? Because I know I had some updated questions, drugs, trials, and stuff, which were not the scenario of NEET.
Sir, actually, I followed your I joined your channel, sir, one on WhatsApp, sir, your group, and even there I used to ask doubts, sir, and most of the time all my doubts were solved. Like whatever I used to ask a lot of doubts, and most of the time you were there or Hemant sir, they used to answer all my. Most of the time they cleared my doubts, sir. And also a lot of things like new things were being shared on that group, sir. So if that even that group helped me a lot to go with my preparation, sir.
So we do have a WhatsApp group which is more active.
Yes,
We as faculty are little less active, but there is a continuous question and answering from the students which keeps happening, and that actually drives more students to read and kind of post their questions, get their questions cleared as and when it is required, and that is even adding on to the confidence of the which you are going to face the exams.
yes,
That is
sir.
all
Yes,
from
sir.
our end. So,
Yes, sir.
anything to tell the upcoming aspiring students?
Sir, I think if you're like I was a fresher, so I can tell the freshers like if you're starting as a fresher, then you have a very less time. You might have some like less time to prepare. So at that time, it's better to like not. It's not possible to go through the whole of Devita at the last moment. So it's better that you like subscribe. If you're subscribing to Doc Tutorials, just watch the videos, make your own notes. That is the most important, I believe. The making your own notes, and then obviously every day I think like try to solve the questions, sir. Whatever topics we are doing, just you are doing, just try to solve those questions, and give GTs, sir, give regular GTs, and those GTs I think you should review in the same day itself, sir. That is what I used to do. I used to review the same GT same day. So that helped me a lot to retain the topics, especially the topics which I did a lot of mistakes, sir. Those topics I could study again. I used to go back to my notes and study those topics.
Right. Thank you so much, Nilanjana, that we have given so many insights. Happy to be your at your end to help you as well.
Thank you so
Thank you
much,
so
sir.
much from our end.
Thank you so much, sir. Thank you so much.